Welcome to Roll Call, the many roles that we all play, a new series of conversations by Watsi about stories of care, courage, and connection. At Watsi, while we love to leverage technology, we believe healthcare is human. Join us in celebrating the many roles that we all play in bringing healthcare within reach for everyone. Today, I'm so excited to introduce to you someone who brings extensive global health experience and grounded leadership to Watsi's mission. Watsi's board chair, Margaret Cornelius. In this episode, Margaret shares what drew her to Watsi, what sets her work apart, and how she balances all of this, having a family and a career rooted in impact. I'm so excited for you to meet her. Let's jump in. Awesome. So, and I'll just introduce myself. So my name is Reena. I am a nurse practitioner by profession. And I've been really, really lucky to be working with Watsi in kind of this ambassador type capacity. It's been a real blessing to just get to know everybody and hear their stories and see the type of impact. Because working in healthcare, as you know, can be very complicated and layered. And there are lots of moments where you're wondering, what am I doing? So this has been a really cool way to feel inspired. So Margaret, you are a public health expert, a Watsi board chair, and most importantly, a change maker. You've worked in global health in the U.S. healthcare space for more than two decades, including 10 years at the Gate Foundation. Now, I would love to know what led you to Watsi and what keeps you committed as a board chair.
Yes, thanks so much for that question. And yes, I have been working in public health and global health systems for some time and continue to do so. And I work really at the very 50,000 foot level of health systems and healthcare policy, meaning working on the technical side, thinking about how, broad-based questions around like the most effective revenue raising scheme to finance a particular kind of health system, or, big policy questions around how providers get paid or how health systems make decisions about what kinds of technologies and services to cover. And it's very, in my mind, I really enjoy it because it is a very systemic kind of approach. But, I'm very detached from clinical service delivery. I don't have a clinical background. I don't work with patients. Of course, I, along with anyone else, I'm always very touched to see a smiling kid post-surgery, or, a mom who has come out of a delivery with a healthy baby. But these aren't folks that I interact with daily. And so when I was at the Gates Foundation, doing the work that I just described, I was approached by the then, he's still the founder of Watsi and served on our board for many years, Chase Adams, to give some kind of free advice on some things that Watsi at the time was working on related to health insurance and how to manage health insurance systems better. And again, because of my system background and orientation, I got really interested in what they were proposing. But the more that I learned about Watsi and learned about how Chase and his co-founder Grace had really looked at the problem of access, I mean, when they were describing something to me, it came across so simply, which is there are people who need things in places where it's really hard to get things, and we want to do something about it. And, I don't have any direct interaction with Silicon Valley. I'm not a, tech person. That's not my world at all, but really kind of getting to know them and learning about what they were trying to do and learning about how they were really leveraging what they knew and how they saw the world to work on things that, I had spent my whole career on. It just was kind of a perfect match. And I was so inspired by the simplicity of what Watsi was built to do and what it continues to do, which is really help people who need help now. The timelines are very different, right? For system change and then somebody just like fully needing access to a surgery, even a relatively routine surgery, and you're a nurse practitioner, a lot of the things that you see or that we would see in places like the United States, which are, cataracts or kind of just outpatient, kind of basic surgery. This stuff, if it's not addressed in a place where healthcare is much, less accessible, can really lead to long-term problems for people. And frankly, that would never happen in a high income place. And so again, I mean, it was a really exciting kind of opportunity and moment, I think, for me to also reflect a little bit about what healthcare really means and like who patients really are. And at the end of the day, they're just people like you or me or anyone, right? These are human beings who have dreams and passions and jobs and obligations, and who want to just not have to worry about this particular health issue that they have anymore. And Watsi really kind of cracked the code, if you will, on how to fix that and how to bring people who otherwise would not be thinking about health financing or health systems challenges, to bring people in and really change people's lives. So, there's a long and rambling answer, but it is a way for me as a systems person to really see the direct impact of, helping someone in a very immediate and efficient and caring way.
That's amazing. Thank you for sharing. And absolutely, we need systems thinkers to help make that impact on the larger scale. And the themes that I'm hearing are the common thread is sort of that human-centered approach. You mentioned you don't work on the front line, but you are touching many lives on a larger scale by doing this type of systems thinking and making that larger impact, and then access to care as well, because that can be certainly a challenging issue across the board, across the world. And being able to get the right care to the right person at the right time is
Yeah.
incredibly important. And it sounds like, Watsi's people-powered approach really either gives complement and almost challenges that traditional model.
Mhm.
And maybe you can speak more to that of, I'm sure you've had extensive experience with different models across the board. How does their approach kind of challenge that normal kind of delivery method that we see?
There's no perfect health system. The even even the good ones that we talk about, like
Yeah.
Canada or Australia or Taiwan, some might say, um, systems are dynamic and ever evolving, and needs are ever evolving, and demands are ever evolving. And so, I guess it's good for people like me because you have job security, like you'll never completely fix it. Um, but at the same time, and this is what I was thinking earlier this morning before this conversation was, timelines, right? Timelines are different depending on where you sit. And if you're a policymaker or a legislator and you're sitting, at the sort of top of the food chain, if you will, the decision chain, you're looking at a reform period, you're looking at, a budget cycle, you're looking at, lots of different things that just frankly take a lot of time and effort to make happen. But if you're someone who has, a hernia, you want help today, right? And so I think where Watsi kind of fits in is we have this amazing network of providers who, and I use network not in the sense that they are networked to one another, but that the way that we've built it is that we are working with providers who are, for their own reasons, are positioned in places where people otherwise would not be able to get care, right? So these are private hospitals, or charity hospitals, or small kind of community hospitals that tend to be um, funded primarily with donations and with contributions from the community. Maybe sometimes the government is paying for some of their costs, but largely these are organizations who reflect the communities that they are in, that serve the communities and the surrounding areas, and that people go to because there's really nowhere else to go, or because they have a choice and they want to go to these providers because they offer, a quality of care that may be superior to what other people think, or they have a service that they can get. And so I think that the kind of the engine of Watsi, we talk a lot about the crowdfunding aspects and the connection and all of that, but honestly, at the end of the day, the engine is the providers, right? We are working with organizations who have reach into places and into populations that are otherwise not served by the quote formal health system. And this is not to suggest that the formal health system can't or shouldn't cover these folks, but they are not doing it for whatever reason. And maybe one day they will be able to, and we can all work towards that, right? If that's a goal that the country has. And Watsi is able to play a role in getting care for people who need it today, while the rest of us, kind of like toil in the legislative halls or in the, big decision places around funding and financing and all of that. And so in my mind, like all of these things need to work together. They shouldn't be working in conflict, but they should be working toward a common goal, right? Which is certainly Watsi's goal, which is that people should be able to get care regardless of their ability to pay. And the way that we do that, of course, is by supporting providers who are aligned to that point of view and who are working with populations who are most vulnerable, right? And the least able to pay, and because of that are often the most burdened by whatever health event they are experiencing. So I guess the long and short of it is, like, even though I'm a pretty linear thinker, I do like to see lots of pieces moving together. And back to your point about patient-centeredness, that all of us, kind of no matter where we sit, need to be keeping that end goal in mind, which is really, the person whose life will be impacted negatively or positively around questions of access to care.
I can kind of see why you were inspired to be a part of this, but maybe you can talk more about that too, because it would be wonderful to hear that your perspective as well.
Yeah, I mean, let's talk about impact, because you hear that a lot in global health, right? And certainly on the sort of donor side, how do we get impact? How do we get impact at scale? How do we get faster impact? We all want impact, of course. We all want to see, the very scarce funding that is available go to the most effective things and to the people who need them the most. And that's, it sounds really simple when you say it, but of course it's incredibly difficult to trace, right? Like a dollar invested here through to someone's life being saved. You can model it, you can, do kind of cool stuff on Statista, or, the Hans Rosling, work from all those years ago. But I think, kind of coming back to Watsi, and I've tested this with some colleagues who are kind of economically or sort of efficiency minded like myself. And, one of the things that's so, in my mind, so transformational about Watsi, even though it's a very small organization working on a huge problem, but, in a pretty tight and small way, is that you really can trace that impact line, right? Like, you can see very clearly for every kind of patient that a person tries to support, or every contribution that's made into Watsi's Universal Fund, with truly like a few clicks of a button, you can see exactly where that contribution went, to whom, for what, to what end, right? And if you're so inclined, you can get the follow-up story, you can click deeper, you can look, if you're very interested in a particular condition or person or geography, like, you can really channel your contribution to that end. And even though, relative to total financing available, or frankly, like total financing need, it is probably the cleanest, fastest, and most efficient model that I've seen in my travels, right? And so on that impact chain, it's like, well, sure, I would love to have the financing gap for all surgeries closed forever and ever, but it's nice to know that at least, this 0.0002% or however much it is actually doing something. While all the other stuff tends to be much more distal and, not something that you can necessarily trace like a direct contribution to. And I think, again, for me as like a systems kind of big picture player, just having that reminder that like, oh gosh, if I really go onto the website today and decide to fully fund, this patient in this place, I have every assurance that it'll happen. Like, I don't have to worry about it. It's done,
Hmm.
and meanwhile, like over here programming, however many millions of dollars, like you hope something happens, 5 years from
Yeah.
now, you might be able to detect, the change or some sort of like additive, value to your contribution. But it, again, maybe that's like a theme from this conversation is right. Like the timelines are so different. You have to wait so much longer to see impact, and it may not ever come. Whereas I think with
Hmm.
Watsi, like it's like, nope, done. I can move on, go get my coffee. Like I just saved somebody's life today. I'm happy to go about my business.
Absolutely. Totally. That direct access, direct impact. And actually, you touched on the Universal Fund, which is
Mhm.
would love to talk more about it. So it's powered by thousands of people giving
Yep.
monthly. And that model has really become the backbone of how we reach patients consistently. So, from your perspective on the board and also being a Universal Fund member for about 5 years now, why does
Mhm.
this steady collective giving really matter?
Yeah. So that's what I think is neat about Watsi and what they do. I mean, we talked a bit about, patient-centeredness, but I think Watsi is also very attuned to like user experience. And I think that does come from the orientation of our founders and sort of our like unique positioning in between kind of like tech and finance and healthcare. Um, and I think that what we learned as we were building Watsi and growing it and exploring different things is that the crowdfunding element of Watsi, what I just described, where you can like go on the website, see a patient, lean in, see everybody else who's leaned in, and you all get that kind of mutual feeling of joy when you've really, you know, leaned in and contributed fully to somebody's care, and you get that kind of like human to human connection, which I think, we all know from the science it really matters to us
Hmm.
as a biological species. Um, and I think that's great, and I want to see it continue, and I love that people love that. I think on the universal fund side, similar to any kind of big pool of funding, when you have more people pooling in and you have more predictability about, what's coming in, what's going out, you can be more targeted and more focused on filling gaps where the needs are. And I mean, this is how health insurance works, right? This is how a lot of big nonprofit organizations work, where in order for you to be able to plan long term and to allocate funding towards patients who maybe haven't attracted as much crowdfunding for whatever reason, or to bring on new providers in places where we know there's a huge need, but we don't currently have a partner, even though partners exist. The Universal Fund allows us to really diffuse kind of the Watsi model, but in a much more like predictable and targeted way, if that makes sense. And so in my mind, like you can do crowdfunding and have that experience, but if you're also a Universal Fund member, you are contributing to kind of the long-term health and stability and power of Watsi to be able to do more things in more places, and to kind of be that like foundational underpinning for the crowdfunding model that everybody loves so much. So for me, it's like a both. It's a yes and not like one versus the other, because I always say this to people. I'm like, I dare you to go on Watsi.org and not like fully fund a patient. Like, just see if you can get on that
That's so
website.
true. So
Because
true.
even when I do it, when I'm a board in
Yeah,
the board chair, I'm in Watsi all the time. But like if for some reason I'm on the website, I'm like, let me just take care of that person. And then,
totally.
I kind of move on with my day.
Yeah, absolutely. And it's like, you want to push that queue along and you know that you can really make that impact. And sometimes
Yeah,
it's not expensive to you in the concept, but it is,
that's right.
so valuable to the person.
So precious.
Um, and so it's really, really amazing kind of to see that for sure. And, my next question was if you could send a message to someone joining the Universal Fund, what would you want them to know? It sounds like you answered it a little bit for me, but anything that you would, send across to somebody like your neighbor who's really interested in giving.
Yeah. I mean, I think we all want to see, um, if let me say it this way, if the opportunity presents itself, right, and you have a certain amount of funding or kind of generosity in your mind, and you want to see those resources leveraged, like you want to see your return on investment, be increased, 10x or 20x or however much, by putting support towards the Universal Fund, you are leveraging everyone else's contributions and getting so much more value, right, than you would if you were to just exclusively go in and fund a patient occasionally. I'm not dissuading. I want people to still do that. Um,
Yeah.
and I want people to give in a way that makes them feel good and makes them feel like they are, doing good for the world. And so it's really, again, it's not like an either or, but I think what I find compelling about the universal fund concept is that, that's where if we do get big contributions from foundations or from other givers, like we put it there because again, it's really it powers the entire infrastructure of the model of the platform. And it also allows us to say, to a donor, hey, your contribution of X will actually be pooled and leveraged against, this sizable pool of resources that will allow us to go from, reaching A level number of patients to like G level number of patients, right? So for me, it's like I'm always looking for leverage and how you can get the most out of, how you can make the money work the hardest. And I do see the Universal Fund as really being the pathway for that as an organization. And again, I mean, it's still kind of like we still apply the same WOTC principles. It really doesn't matter like which account the funding is in. Everything is still almost entirely directed towards our medical partners. You can still see exactly who got treated for what, where. It all goes into the same kind of data platform, right? So like going back to what we were saying about impact, like the chain is still incredibly fast and incredibly transparent and clear. And I just think it's a really innovative way for WOTC as a nonprofit, right, to fundraise in different modalities, but to still apply, the same principles to what we do, where like patients are our number one target, our providers are the way for us to reach that target, our donors are the most important, engines behind that. And however the resources are channeled, it still is going to fund life-saving, and life-changing care for people who otherwise wouldn't be able to get it.
Yeah, absolutely. That transparency, accountability, and kind of that high level outlook is really, really something that is amazing, and optionality as well. So having,
Mhm.
multiple ways to give and still knowing that that's consistent in ways because it makes you feel good and you're also feeling comfortable in whatever capacity you can offer. It's really also wonderful to see how that translate to the impact of, helping close health gaps
Right.
across the board and really being a part of global advocacy and then sharing stories, like sharing
Mhm.
true stories of patients, providers, pretty much everyone at every level. And that's something that's incredibly unique as well. And so I would love to hear what you think or what you hope Watsi will achieve in the next 5 years and what role you kind of see for donors like yourself in getting there.
It is such a unique model. And I recognize that like the way that I experience Watsi is going to be unique to me. And and so there may be folks who just love going on Watsi because it just makes them feel good to see, a patient and like, yeah, they could probably contribute, however many thousands of dollars to the Universal Fund a month if they so chose, and it would be automated and they would never have to really worry about it. But it gives them joy, right? To like open up their laptop and get their coffee and kind of check in with who's out there and who needs help. Um, and so I love that. And I think that kind of thinking about Watsi as we go forward, um, Watsi is super responsive to its donors and to its network, right? And so we are always trying to like test and evolve and take feedback and integrate it into how we show up and how we build and what we prioritize and what we focus on year to year. And so even though we are a nonprofit and we have a very specific mission, I think we kind of behave more like what I would characterize as like a provider, like a vendor, like our customers are our donors. Our product is the patients, and the providers who are supporting those patients. And so the closer that we can stay to kind of what our customers want and offer them experiences that will help us, increase our products, like increase our surgeries, the better. And I think that that's a really exciting element of Watsi that's very different from other nonprofits in this space. So I guess what I would say is like, I don't really know what the future will hold, but I am very confident that Watsi will be right at the forefront of like what people are interested in and excited about, and will either be ahead of it or incredibly responsive to it and will evolve accordingly. I mean, we do a lot of stuff with um, storytelling that you talked about. We do a lot of stuff with colleges. We have, people who are kind of come to us and propose really interesting, cool things that like we never would have thought of, but we can immediately kind of pivot and build, to get that and to get more people excited about patients. And so, I'm kind of, I guess, on the older side at this point in this journey, but it's so fun to see just what our, kind of younger teams and younger connections are thinking of and what compels them and meeting their needs and getting them and keeping them excited. So I love that spirit of kind of innovation and trying things and just seeing what works and being ready to, fail a little bit, and then pivot and try something different. It's a really fun culture and I hope that we keep it over the next 5 years.
Absolutely. And it sounds like it's open to all forms and all industry. I actually really like the way you
Absolutely.
described it in terms of products. So my husband's in technology, so lots of
Okay.
times it's us translating kind of similar things in different ways. And you just totally reminded me of, the way he might translate something that, you're
Yep.
doing in terms of care, and it's a really unique perspective. And I think it actually speaks to a broader audience as well, because then you're like, oh, okay, that totally makes sense. Everybody is bouncing off each other's ideas and brainstorming things and actually putting that into action, and using that innovation and like openness to what's the
Yeah.
potential of what's out there to lean into that versus to resist it. So really, really cool to hear that.
Yeah. I couldn't agree more. I mean, it's we all kind of live in our bubbles and our sort of like little ecosystems. And again, I think Watsi, just given its orientation, given its positioning, given how we see the world, and certainly how RED tries to push the organization. I mean, it really is it's a community. And so, but everybody's opting in for a common purpose, right? Which is
Hmm.
so fun. But all of those different community members are completely disparate. Like, it's so cool.
Yeah.
You can go in and see like a patient that's been funded, and you can click and see like who in the Watsi community, right, if they agreed to kind of have their information shared in terms of like not their necessarily like their specific contribution, but that they are part of funding a patient. And I mean, it's like people all over the world.
Yeah.
And I've talked a lot about patients, and I've talked a lot about, providers, but I think if you really take, even just 5 minutes to look at who all is with you in funding a patient, and you're just like, oh my gosh, I can't believe that somebody in like, Tokyo, and then Geneva, and then like Kalamazoo, Michigan, and then some, it's just wild to know that like
Yeah.
we are all connected, through a patient who just needed cataract surgery, right? And I reflect on that a lot, when I think about the power of Watsi, and just really love that element of it.
Totally. And who would ever think we would all agree on one thing? I feel like
That's right.
that is so rare these days. I feel like
Yeah, exactly.
the
Yeah.
message
Yeah. I
gets
mean, it's like,
lost.
it's completely like, it really doesn't matter like who you are, what you think. It's like, well, we all just really want this person to not have to deal with this anymore. Like,
Exactly.
and yeah, it's a really wonderful feeling.
Yeah, it's so needed these days. So yeah,
For sure.
I love the way you put
Yeah, and
that.
I suspect that we haven't tested this because I'm not sure how we would go about doing it, but I suspect, right, that, and I know for myself, right, I'm like, sometimes there are feelings, and this is just kind of the world in which we live, and where you do feel kind of like, oh, like I just don't even know where to start, right? I just everything
Yeah.
feels upsetting and scary, and challenging, and things are scary and upsetting and challenging. I don't mean to say that it's not, but the flip side, right, is that for truly like the price of your morning coffee, like you can go in and like with however many other donors putting in exactly the same amount, right? Instead of buying lattes today, we all decided that we were going to fund somebody's, cataract surgery. Like, that feels pretty good. That feels pretty good.
Absolutely. Yeah. We need that feel good. We
Yeah.
need that, moment to share just some joy because there is a
Yeah.
lot going on. And you're based in DC now, is that right?
Yeah. We live
And
right outside
you're
of the DC in Maryland. Yep.
wow, and you're raising kids and you're working in this space and it's a lot. How do you find that you're able to balance all of that?
Um, that's a great question. And it's like the perpetual, that's like the evergreen question, right?
Yeah.
Um, I think that what we try to do, right, in our family is, balance out like the pursuit of whatever goal it is, whether it's, a professional goal or a kid's kind of educational or sports goal, with like a mentality of, it's important to work hard, it's important to have goals, it's important to stay focused, but it's also important to take a minute and look outside of yourself, right? And remember that there are a lot of people and a lot of communities in this world who are also working really hard and in pursuit of important goals, um, but for place or position or population will not have the same opportunities that our family certainly has, and that many families in our area have. And it's not like a guilt thing, it's really like it's a duty thing, like it is our obligation to others, right, to help when we can, and to remember that we're all just humans trying to get by, and that, your challenge is probably a similar challenge for someone else in a very different part of the world. And that if you
Hmm.
have the opportunity to help, you should, because it's what you should do. It's being a good human means helping other people when you can. And kind of getting back to the point of like things that I think a lot of us can agree on, like, I think that's one of them. You want to help if you can. And so
Yeah.
that helps us keep things in balance, right? It helps us to pull back, from like whatever, if you're on your 17th hour of driving a kid to some sports thing, or, like arguing, arguing with other
Yeah.
parents on the WhatsApp thread about like the uniform, or, kind of like pulling back and remembering that while all these things matter, and, we all want to get through the day in the best way we can, like that. There are a lot of people out there who just really need a little bit of help, and it has nothing to do with them like deserving it or not. It just has to do with circumstances. And if you have the opportunity to, just make someone's life a little bit easier, you should do it.
And that's a wrap on this episode of Roll Call. Huge thanks to Margaret for sharing her time, her story, and all of the insight she brings to Watsi. If something she said stuck with you, we'd love to hear it. Drop a comment, share it with a friend, or reach out. And if you want to see the impact up close, check out Watsi's Universal Fund community. It's where all of this work comes to life every month. Thanks for tuning in. And we've got more conversations coming soon, so stay close.